Eric Dane, Dr. Max Sloan from Grey's Anatomy, Carl Jacobs from Euphoria, died February 19th, 2026. He was 53 years old, less than a year after announcing his ALS diagnosis. For many people, ALS doesn't just affect their bodies, it also changes their brain, their emotions, their personality. And if you're caring for someone with ALS, your mental health is at risk too. Today, I'm using Eric Dane's story to talk about the psychological effects of ALS that patients and families face, but almost no one warns them about. I don't know Eric Dane's personal medical history. I'm not speaking about his specific experience, but I'm speaking about what research shows happens to many people with ALS and what families need to know. I'm Dr. Eyre, integrative psychiatrist and lifestyle physician. My deepest condolences to Eric Dane's family and everyone who loved him. Eric Dane went public with his ALS diagnosis in April 2025. He became an advocate. He raised awareness. He fought for research funding. He was recognized by the ALS Network and I Am ALS for his courage and his voice. And that's what I want to build on today. Because when someone with a platform speaks up about ALS, it creates an opportunity to talk about the parts of this disease that most people never hear about. Not just the physical effects, but also the psychological effects, the emotional devastation, the mental health crisis that affects both patients and caregivers. When you're diagnosed with ALS, your brain doesn't just process information, it processes threats. You're being told that your body will progressively fail, that you'll lose the ability to walk, speak, swallow, and eventually breathe. The average survival time after diagnosis, 2 to 4 years. Some people live longer, some don't make it that long. This isn't just bad news, it's existential terror. Research shows that almost everyone diagnosed with ALS experiences shock, grief, anxiety, and depression as they adjust to a terminal diagnosis and rapid loss of function. You're grieving losses that haven't happened yet. Your future, your independence, your career, your identity. This is called anticipatory grief, and it's one of the most painful forms of grief because it never stops. Every new symptom is another loss. Every milestone, like needing a wheelchair, a feeding tube, or a ventilator, is another funeral. For someone whose career depends on their physical presence, like an actor, an athlete, a performer, the psychological weight can be even heavier. You're not just losing your body, you're losing your purpose, your livelihood, the thing that gave your life meaning. Now, here's where it gets really complicated, and this is what doctors rarely explain upfront. Depression rates are significantly higher in people with serious medical illnesses, but ALS is different because unlike other chronic illnesses, ALS is progressive, terminal, and fast. You don't have time to adjust. You don't get to plateau. Every month brings new losses. Studies show that many people with ALS develop major depressive disorder, generalized anxiety disorder, panic symptoms, and severe sleep disruption. And it's not just psychological, it's biological. ALS triggers massive inflammation in the brain and body. This inflammation disrupts neurotransmitter production, the chemicals that regulate mood, motivation, and emotional stability. Your brain is literally under attack. Add to that the loss of autonomy, the physical decline, the social isolation, and the constant fear of what's coming next, and you have a perfect storm for mental health collapse. But here's what most people miss. These mood symptoms are treatable, even if the disease is not. Antidepressants, anti-anxiety medications, and sleep support can make a profound difference in quality of life. They won't stop ALS, but they can give you back some peace, some sleep, some emotional stability in the middle of chaos. But there's something even more frightening that happens to some people with ALS, and families are almost never warned about it. In a subset of ALS patients, the disease doesn't just affect motor neurons. It affects the frontal lobe, the part of your brain responsible for decision-making, emotional regulation, and personality. It's called frontotemporal dysfunction. And research shows it can look like 1. Apathy, losing interest in things that used to matter. 2. Emotional blunting, feeling flat or disconnected. 3. Disinhibition, saying or doing socially inappropriate things. 4. Executive dysfunction, struggling to plan, organize, or problem solve. 5. personality changes, becoming irritable, impulsive, or emotionally distant. These are neurological changes, not character flaws. Again, I don't know if Eric Dane experienced any of these symptoms, but I'm sharing this because it happens to a significant number of ALS patients, and families need to know it's possible. And if you're a caregiver watching this happen, what I'm about to say next might be the most important part of this video. Because ALS doesn't just devastate the person diagnosed, it devastates the people who love them. Research shows that caregivers of people with ALS face some of the highest rates of burnout, depression, anxiety, sleep deprivation, and anticipatory grief of any caregiving population. You're watching someone you love lose everything, managing medical equipment, medications, appointments, and physical care, often while trying to maintain some sense of normalcy for yourself and others around you. Trying to be strong when you're falling apart inside, grieving while caregiving, and you feel guilty for feeling exhausted. Family members and caregivers often suffer silently. They don't ask for help because they think they should be able to handle it. But here's the truth. You can't pour from an empty cup. If you're caring for someone with ALS, your mental health matters. You're not selfish for needing support. You're not weak for needing a break. You're human. So why does ALS cause these profound mental health effects? The answer is in your biology. ALS doesn't just attack motor neurons. Research shows it triggers a cascade of biological changes that affect your brain and nervous system. First, neuroinflammation. ALS triggers chronic inflammation in the brain, which disrupts neurotransmitter production and communication between brain cells. Think of it like static on a radio. The signal is there, but it's distorted. Second, stress hormones. Living or caring for someone with ALS keeps your body in a constant state of fight or flight. Cortisol stays elevated. Your nervous system never gets to rest. Your body thinks it's being chased by a lion every single day. Third, mitochondrial dysfunction. Your brain's energy production crashes under chronic stress and inflammation. When your brain is low on fuel, focus, memory, and emotional regulation all suffer. So what do? For patients, therapy, especially grief counseling and acceptance-based approaches. Psychiatric treatment when appropriate. Antidepressants, anti-anxiety medications can restore quality of life. Sleep support, because sleep is when your brain processes emotion and stress. Nervous system regulation techniques, breath work, meditation, or gentle movements when possible. Social connection, because isolation makes things worse. For caregivers, respite care. You need breaks, even if it's just a few hours. Counseling. Your grief and burnout are real and deserve treatment. Community. Connect with other ALS caregivers who understand what you're going through. Boundaries. It's okay to say no, to ask for help, to protect your own mental health. The goal isn't to fix ALS. The goal is to preserve dignity, connection, and quality of life for as long as possible. Eric Dane used this platform to raise awareness of ALS and advocate for research funding. He was recognized by the ALS Network and I Am ALS for his efforts. That advocacy matters. Because the more we talk about ALS, not just the physical symptoms, but the mental and emotional devastation that research shows is common, the more we can support patients and families through the unthinkable. Many people think ALS only affects the body. That's not entirely true. The American Academy of Neurology recognizes the association with cognitive impairment, behavioral issues, and frontotemporal dementia. Cognitive impairment occurs in about 28% of patients. Behavioral impairment, including irritability and social disinhibition, affects approximately 39% of patients. Dementia, meeting criteria for frontotemporal dementia, occurs in 15 to 41% of patients. However, many patients maintain sharp cognition throughout the disease, and most patients and their caregivers experience emotional suffering that is real, valid, and deserving of treatment. If you're living with ALS or caring for someone with ALS, please ensure you protect your mental health and get all the care you need.